Have you ever wondered why the same drug can work perfectly for one person but barely work or even cause harmful side effects in someone else? The secret often lies in your DNA. This field of science is called pharmacogenomics and it's changing the way we think about medicine. Pharmacogenomics is the study of how your genetic makeup influences the way you respond to drugs. Every person's DNA contains small variations known as polymorphisms. These tiny differences may not change how we look or feel day to day, but they can dramatically affect how our bodies absorb, metabolize, and eliminate medications. For example, one person might clear a drug from their system very quickly, while another person with a different genetic variant might break it down very slowly. That difference can decide whether a treatment is effective, too weak, or even toxic. Let's take some real examples. Blood thinners like warfarin are life-saving drugs, but their dosing is tricky. Too little and they don't prevent clots. Too much and there's a risk of dangerous bleeding. Certain genetic variations in liver enzymes and clotting proteins can help predict how much warfarin a patient actually needs. Another case is pain relief. Codeine, a common painkiller, has to be converted into morphine by an enzyme in the liver. Some people have a gene variant that makes them ultra-fast metabolizers, which means they convert codeine to morphine too quickly, leading to overdose risk. Others are poor metabolizers and get no pain relief at all. Even in cancer treatment, pharmacogenomics plays a role. Drugs like 5-fluorouracil used in chemotherapy can be toxic for patients with certain enzyme deficiencies. Genetic testing can identify those at risk before treatment begins. These examples show how understanding our DNA can guide safer, more effective prescribing. Medicine has often relied on trial and error. Doctors prescribe a drug, see if it works, and adjust if it doesn't. But pharmacogenomics allow us to skip some of that uncertainty. By tailoring treatment based on genetics, doctors can choose the right drug at the right dose from the start. This means fewer side effects, better outcomes, and potentially lower healthcare costs. It's a cornerstone of what we call precision medicine, healthcare that's customized for each individual. Pharmacogenomics is still growing, and not every drug has a genetic test available yet. But as research expands and genetic testing becomes more affordable, we are moving closer to a future where your DNA guides every prescription you receive. Don't forget to like, share, and subscribe to my channel.